Hi, so my name is Ashley. I'm doing this for my instructor methodology class. I'm going to be talking to you guys about organ donation today. So on average in the U.S., there is an average of 1,500 people on the waiting list for an organ donation. Of those people, around 2,000 are under the age of 18. This goes all the way down to 1 year of age or younger. Each year, due to people not being able to get the organs that they need, we have around 8,000 deaths annually. So since 1988, there has been around, or a little over 732,000 organs transplanted in the U.S. alone. So that's just within 30 years. Their first kidney transplant was done, it was the first organ that was ever transplanted. That was done in 1954. Around 1960s, there was the heart, liver, and pancreas was done. Lungs were not done until about 1980. You have two different types of donors. You have living and deceased. Your living donors, there's three different types. You have direct. So if you want to donate an organ to a family member or a friend and you're a match, you know exactly who that organ's going to. So that would be your direct. Your non-direct would be like if you were bone marrow, if you were on a transplant list for that or a donor for that and they call you up, you don't know who that's going to. Some random person. The paired donation, it's less common. So if you have two people who are getting the same type of organ, they're not quite 100% match for the organ that they're set to receive, but the other person's organ is 100% match for you and yours for theirs. You can trade organs with that person. Definitely a lot less common, but it does happen. For the deceased donation, the person has to be declared brain dead. For that, they've had to experience some type of major trauma where they have bleeding, swelling, lack of oxygen going to that brain. But in order to be a donor still, they have to have blood and oxygen continuously going to the body to help preserve the rest of those organs until the time of harvest. Anybody organ donors? Why do you want to be an organ donor? Just felt like being nice? Okay. You?
One of my family members needed an organ donation, so became an organ donor after he had his.
Okay.
Or he got a donor organ.
All right. So one life or one donor can save up to 8 lives. It can also help improve the lives of up to 77 other people. They can harvest lungs, heart, liver, pancreas, kidneys, intestines, corneas, bones, valves, skin, even veins. So up to those other, the skin and tissue type of organ or donors can, where you include the rest of your people that you can help improve their lives or their quality of life. Here we have a breakdown of all the organs that have been transplanted since 1988 up until now. You'll notice kidneys are your biggest thing that gets transplanted. We've been able to transplant up to 10 arms for people. They've been able to do abdominal walls, uteruses for females. So the network that does this, or is actually a computer system, it's called UNOS. And what it does is it helps match the donors to the recipients. It was developed by a group of hospitals and the foundations that help specialize in these donations to help from the beginning to the end to the person go through the process. They just developed this because a lot of organs were going to waste. They were having trouble outside of their own hospital being able to find other matches for them, and the time frame that they needed for that organ was no longer viable. So they created this system to where from one coast to the other. They can look up and see what organs match anybody on that list. The biggest things they need for them to make the matches, you gotta know the blood types. They have to match or you're gonna get a big chance of rejection with it. Your body types, pediatric patients respond better to pediatric organs versus adult organs in peds. The severity of the medical condition and how long they've been on the wait list. The distance between the hospitals for the patient to the transplant hospital versus between the two hospitals where the harvest is being done and the transplant will be done. And then the biggest other key factor is that patient available to do the transplant at that time. You know, they could be sick. If they are, that's going to knock them out for getting that transplant done then. If for whatever reason they can't get to the phone or just can't get to the hospital in the time frame that's allowed. So UNOS splits the U.S. up into 11 regions, and this is so they have a better chance of transporting these organs even across state lines. They've grouped them up into 11 different places as far as how long it would take to get one organ to another hospital, another state, so that way they have a better chance of helping people. North Carolina is in the region 11, so they cover, of course, us, South Carolina, Kentucky, Tennessee, and Virginia. In the U.S., we have 5 local donors services. So you got Life Shares, Donor Services, Donate Life, your Old Dominion Eye Foundation, and your Miracle Insight. Those are the organizations that people go through to help them facilitate that donate or the receiving the transplant. We got 4 transplant centers in the state of North Carolina. It's your bigger hospitals here, Duke, UNC, Baptist, and Vidant there. So the cost for a transplant, as you can see, is pretty expensive. Corneas are $30,000 just for that. Heart's 1.4. Even intestines are 1.1. So for the cost of it, there's no cost to the actual donor themselves. If it's a deceased donor, the families are only going to be responsible for the medical care up until the time of death is called, and then for funeral arrangements. And then the living donors, it's the same way. They're not responsible for that. The recipients, private insurance covers the cost. If they don't cover the full cost, then the Transplant Center Organization Acquisition Fund helps cover the rest of that. They'll cover for the surgery that itself, for medications afterwards, for any type of rehab that they have to have done afterwards. They'll help cover all of those costs. So here it's a breakdown of North Carolina alone for 2018. It's for the waiting list that we have. Kidneys, again, are the biggest ones. Your intestines, there's still 6 people who need intestinal transplants here in the state alone. This is more of a national thing for between January and April of this year alone. It's the people who have had transplants so far. There's been a little over 11,000 people so far this year in just those 4 months between January and April to receive transplants. This one covers across the whole U.S. It breaks down the number of transplants that have been done from 2013 to 2017. There's been a steady increase in the number of donors that have come up between deceased and living. There's been, as you can see, quite a bit there. It's a nice steady increase, better medical equipment and odds of surviving transplants, and just more awareness of the need for them. So here is another breakdown of a waiting list. Breaks down by age. You can see less than 1 year. There's 3 kids that need it. Breaks down the different ones. The biggest need is your group between age 50 and 64. And again, on all of those, kidneys is like your number 1 for that. So your heart, the biggest reasons people end up with heart transplants, your coronary artery disease, your cardiomyopathy, your congenital heart defects, your valvular heart disease. From the time of the harvest to the time the transplant takes place, between 4 to 6 hours. So there hits your regions where it breaks down there to make sure you can get the organ to where you need to in that time frame. Lungs, your biggest reasons, your COPD, your emphysema, pulmonary fibrosis, your sarcoidosis, and your pulmonary hypertension. They also have a 4 to 6 hour time frame there for that to take place. Kidneys, again, your number one big thing. That covers your end-stage renal patients, your chronic, your uncontrolled hypertensive patients, your polycystic kidney disease. You have a little bit more of a time frame here. You have 24 to 36 hours for that. Liver, your hep C patients, cirrhosis, your hemochromatosis, your cystic fibrosis patients as well. Wilson's disease is another big one that gets those. That one is just a buildup of copper in your system. You're not able to filter it out, and it really affects the liver and it starts to kill it. With these, you have 8 to 12 hours to get that one transplanted. Your pancreas, usually if they get a pancreas transplant, they'll also get a kidney transplant. Your pancreas helps your type 1 diabetics to recover. They have 8 to 12 hours to find somebody to match with that one. Your intestines, they kind of go along with your liver transplants for the most part. If they're getting an intestine transplant, they're probably getting a liver as well. These are your Crohn's patients, your major traumas, and the occlusions and like surgical adhesions. So also you have your corneas. They are for your eyesight. They help, when they get those done, patients are normally awake during that procedure. They're a little sedated, but they're still able to talk during the surgery. The bone, like your amputee patients, normally for a bone marrow transplant, or not a bone marrow, but a bone transplant, you're looking at around $1,200 for it. You got two different types of the transplants there. You can either get it from the person itself, which is an autograft. So they use like your ribs, bones from your wrist, your pelvis area. And then you have an allograft, which you get it from a cadaver or a deceased donor. Skin helps your burn patients. That usually just covers as far as like your appearance, just for their more quality of life there. Depending on how much skin has to be transplanted, you're looking at around $4,000 for that. For your tendons, it helps rebuild your joints. They run around $3,000. Your veins to help with your circulation, all over your body, about any vein can be transplanted. Depending on what it is, you're looking between $300 to roughly around $1,100 for it. Your valves for your heart defects, depending on how many, can be between $80,000 and $200,000 for that. And all of these last six is just to help improve someone's quality of life. It's to help them have, it's not really necessarily to save their life as you would with your other organs. And if you are not an organ donor and you would like to be, you have 3 different ways to be able to go about that. You can visit, for North Carolina, you would have to go to the Donate Life NC to get registered. It's a quick process. You are also able to go to your local DMV and get that. You'll get the little heart symbol on your license. Or if you have an iPhone, you can use the health app there, and it'll walk you through the steps to get registered. And again, if you're not, it's a good way to help people even after you're gone, to help with, either just their quality or maybe actually save somebody's life. Are there any questions? All right. Thank you guys for sitting and letting me talk to you.